So we're diving into the world of clinical coding today. You've sent us some really interesting RoleCatcher guides on this. Seems like you're trying to figure out if it's the right career path. Right. Well, let's see what we've got.
It's definitely a field where detail matters. It's like being a translator, but instead of languages, you're deciphering medical charts into this universal language that everyone in healthcare can understand.
Okay, so, what do they actually do all day?
It's more dynamic than people might think. Imagine a doctor's notes about a patient, right? Let's say they treated a complex fracture. The clinical coder analyzes those notes, and often things like lab results and imaging reports too, then translates all that into specific codes.
So it's not just like coding for a broken bone. There's a whole system for everything.
Exactly. These codes, they describe everything. Diagnoses, treatments, even the medical equipment used. And they're vital because those codes tell the whole story of a patient's healthcare in a way that insurance companies, researchers, everyone can understand.
And if those codes are wrong, seems like that would be a huge problem.
You're right. A wrong code. That could mean a patient gets an inaccurate bill, a hospital might not get reimbursed correctly, researchers could end up with bad data. It's meticulous work. It impacts so many aspects of healthcare.
Not a job for someone who gets bored easily then.
Hmm.
You need to be detail-oriented for sure. But is the work environment as solitary as it sounds?
Not at all. Attention to detail is key, but clinical coders are part of a team. They're often in hospitals, clinics, places like that, collaborating with doctors, nurses, the whole healthcare team.
Huh, so there's actual human interaction. Interesting. I pictured it as a very solitary job.
Yeah.
What's an example of that collaboration?
Sure, so let's say a coder is reviewing a patient's chart and something's unclear, maybe about the diagnosis or what procedures were done. They'd reach out to the doctor directly, get clarification, or maybe work with the billing department to fix any discrepancies that could affect reimbursement.
So being a strong communicator is important too.
Sure.
Not just medical jargon into codes, but translating between different teams.
That's a great way to put it. And that's even more important now with remote work. A lot of clinical coders have the flexibility to work from home now.
You could be analyzing medical records from your couch.
Hmm.
Wow. Okay, so we've seen what they do, where they work, but what's it really like? The upsides, downsides, let's start with the good stuff.
Well, job outlook is a big one. The Bureau of Labor Statistics, they project employment for medical records specialists, which includes clinical coders, is going to grow much faster than average over the next decade.
That's great news. Job security is important, probably fueled by a few things, right? Aging population, more demand on healthcare. All the advancements in medicine means more specialized treatments that need coding.
Exactly. It highlights how crucial coders are becoming. They keep the system running smoothly, patients billed correctly, data captured accurately.
Unsung heroes of healthcare in a way, making sure it all keeps ticking. But beyond job security, what else?
Earning potential is good, for one. And with demand so high, those salaries are likely to stay competitive. Plus, the work can be intellectually stimulating. You're always learning, solving these puzzles, making a difference.
A brain workout with real-world impact. Love it. But there were some challenges too, right?
True, there are always two sides. This isn't for folks who get bored easily or hate paperwork. It takes meticulous attention to detail, deciphering medical jargon. And you've got to stay updated on coding guidelines. They're always changing.
Always learning and adapting. New medical technologies, treatments, always emerging.
Precisely. And there can be pressure, deadlines, maintaining that accuracy can be stressful at times.
So a love of learning and a high tolerance for deciphering medical mysteries is key. For someone listening who's thinking, this asks me, what do they need? What are employers looking for in a clinical coder?
Well, a solid education is important. Health information management, health informatics, even a medical coding degree itself. But practical experience is really valuable. Internships, entry-level positions, those are great for gaining experience.
Makes sense. Can't learn how to decipher a doctor's handwriting from a textbook, right?
Right. And certifications are a major plus. Certified Coding Specialist, CCS, Certified Professional Coder, CPC. These show you've mastered those complex coding systems.
Speaking of, what are the key ones aspiring coders should know?
Two big ones, ICD-10 and CPT. ICD-10 is the International Classification of Diseases, 10th revision, that's for coding diagnoses. CPT is the current procedural terminology for coding procedures and services.
So, like learning a new language, the language of healthcare. And I'm guessing interviewers want to see that fluency.
Absolutely. They'll ask questions to see if you understand these systems and how to apply them.
Not just memorizing. You have to know how to USE them to tell a patient's story accurately.
Exactly. You might be asked to describe a challenging coding case, how you solved it, or they'll give you a scenario and have you walk them through the coding process. They want to see how you think, how you analyze your communication.
Because you're often the bridge between the medical world and, say, insurance companies, right?
Exactly. You're taking this complex information and making it understandable.
You're taking this complex information and making it understandable. It's a vital role. And they want to know you can handle it. But it's not all about acing the interview, right?
Yeah.
Let's say someone gets the job. What's next? What does career progression look like in this field? Is there room to grow, or are you kind of stuck in your coding niche?
Oh, there's definitely room to grow. It's not a dead end, not at all. So you might start as a junior coder, right? Maybe focusing on a specific area, like inpatient coding or outpatient. But then with some experience under your belt, more certifications, you could move into auditing. That's where you're reviewing other coders' work, making sure it's all accurate, compliant.
So you go from cracking the codes to being the code enforcer. I like it.
Exactly. Or you could move into management, leading a whole team of coders. Some people even use it as a springboard to other healthcare roles.
Wow, so it's not just a cubicle forever. What other roles can you branch out to?
Well, two popular paths are clinical documentation improvement and health informatics. Clinical documentation improvement specialists, they work on making those patient records even better, more accurate, complete, consistent. And health informatics, that's using technology to manage and analyze health data, really cutting-edge stuff.
So a background in clinical coding opens up all these doors in healthcare. And that's what I find so exciting about this field. Stable career path, tons of potential. And it's only going to be more in demand as healthcare relies more and more on data. Speaking of which, it's easy to get lost in the technical stuff. But this work, it has a real impact on people's lives, right?
Oh, 100%. Yeah, it's about fair reimbursement, sure, but it's bigger than that. It's about making healthcare data better, which means better care for patients, more effective research, really understanding those health trends. Accurate coding paints a picture of what's happening in healthcare, so better decisions can be made at every level.
So for anyone listening who likes the idea of being a behind-the-scenes influencer in healthcare, this could be it. It's not just codes, it's the why behind them. How it all makes for a healthier world.
Exactly. If you want a career that challenges you intellectually and is personally rewarding, clinical coding's a unique opportunity. You're using your brain, you're detail-oriented, and you're making a positive impact. That's a powerful combination.
It really does sound like a fulfilling career. And you're not just crunching numbers, you're ensuring this accuracy, this integrity of healthcare data. And that affects everyone. Plus, it's always evolving. There's always something new to discover.
Yeah, and that constant change, it brings up a really interesting question. Healthcare technology is advancing so fast, data is becoming even more important.
Yeah.
So what about AI? What about machine learning? What role will they play in clinical coding in the future?
Great question. Will we even need human coders? Or will their skills just have to adapt? Something to think about if you're exploring this path.
Oh, absolutely. AI, machine learning, they might automate some things, but I don't think they'll ever fully replace human coders. Medical language is complex. It requires critical thinking, problem solving, and there's an ethical component to healthcare data that really needs that human touch.
So the future of clinical coding, it might be this partnership between humans and technology, each playing to their strengths to make sure healthcare data is accurate and reliable. Exciting time to be entering this field.
No doubt. And for those who are up for the challenge, the future's looking bright.
Exciting time to be entering this field. But even with all this change on the horizon, it comes back to what we've been talking about at its core. Clinical coding is about taking this complex medical information and turning it into something everyone can understand, right?
Absolutely. And it's more than just the technical side. It's about this commitment to better healthcare, making sure patients get the best care, making sure resources are used properly, and just keeping healthcare moving forward.
Right, constantly learning and growing. So it's not just about knowing the codes, it's understanding the why those codes matter, how they contribute to a healthier system for everybody.
Exactly. It's about making a difference one code at a time.
Perfectly said. And that's all the time we have for today's deep dive into the world of clinical coding. We hope you found it helpful and maybe even a little inspiring. Until next time, keep those brains curious and keep those questions coming.